Hello everyone, welcome back to my channel. If this is your first time here, my name is Nurse Lizzie, and on this channel, I talk about health topics in a simple and practical way. I'll be talking about something that's currently affecting communities right here in Nigeria, Lassa fever. There has been a rise in Lassa fever cases and deaths earlier this year. And that's why this video is especially important. It's not just to inform you, but to help you protect yourself and your loved ones. So let's break it down in a clear, easy to understand way. What Lassa fever is, why it's rising, symptoms, diagnosis and treatment, and prevention. Lassa fever is a viral illness caused by the Lassa virus. It's part of a group of viruses called hemorrhagic fevers, which means in severe cases, it can lead to bleeding and organ damage. It's endemic in West Africa, meaning it occurs regularly here. And Nigeria is one of the countries most affected. Recently, health authorities have reported a notable increase in Lassa fever cases in Nigeria. In early 2026, the Nigeria Center for Disease Control (NCDC) confirmed a steady rise in new infections and deaths from Lassa fever. In one update, over 39 new cases and 17 deaths were recorded across multiple states like Edo, Plateau, Bauchi, and others, showing more spread compared to previous week. Recently, Plateau state authorities confirmed 11 cases and 4 deaths across several local government areas. Stark reminder that the disease is still active in communities. These increases are part of seasonal patterns. Lassa fever tends to spike during the dry season, but the numbers are still concerning, particularly because they result in loss of life and strain on local health facilities. Let's talk about the drivers of this rise. The first reason is seasonal pattern. Lassa fever usually increases during the dry season around November to March. The next is environmental conditions. Houses and food stores infested with multi-mammate rats that carry the virus increase risk. Another reason is late reporting. Many people delay going to health facilities, thinking symptoms are malaria or typhoid, allowing the illness to worsen. The last reason is poor sanitation. Conditions that attract rats like dirty compounds, uncovered food, litter make communities more vulnerable. Symptoms usually show within 6 to 21 days after exposure and can be mistaken for other diseases. Early symptoms include fever, headache, weakness, sore throat, and muscle pain. As the illness progresses, you may see vomiting, diarrhea, bleeding from gums, eyes, or nose, difficulty breathing. Severe cases can lead to organ failure and death. If you have persistent fever, not responding to malaria treatment, don't wait, go to a health center immediately. To confirm Lassa fever, laboratory tests must be done at designated treatment centers and laboratories. Treatment usually includes antiviral medications like ribavirin if started early, fluids and supportive care, and monitoring in a hospital setting. Self-medication at home is dangerous, especially during outbreaks where symptoms overlap with other diseases. Prevention is the best weapon, especially since there's no widely available vaccine yet. Here's how you can protect yourself and your family. Clean your surroundings, remove garbage and refuse that attract rats. Store food properly, keep grains and foodstuffs in sealed containers. Block rat entry points, seal holes and gaps in the house. Also, wash hands regularly, especially after handling food. Avoid contact with rats and their waste, and lastly, health workers should always use protective equipment. Practical behavior change at household and community levels can reduce cases significantly. If you experience high fever, severe weakness, bleeding, or confusion, symptoms that don't go away with malaria or typhoid treatment, go to the nearest health facility immediately. Early treatment saves lives. Lassa fever remains a serious health threat, and recent reports show that infections are rising across several Nigerian states. But you have power to keep your environment clean, store food safely, and seek healthcare early. You can protect yourself and help stop the spread. If you found this video helpful, please like, share, and subscribe. And do share it with your family and community so that we can all stay informed and safe. Thanks for watching. Stay healthy and stay informed. Bye for now.